Are allergy medicines safe to take with thyroid medicines? That's a really important question, and the answer depends on which allergy treatment you're using. If you're managing a thyroid condition, this matters more than you might think. Millions of people in the UK take levothyroxine or carbimazole every day, and reaching for an over-the-counter allergy remedy without checking first could affect how well your thyroid treatment works. So let's break it down. Allergy medicines can interact with thyroid medicines in a few different ways. They can interfere with how your thyroid medicine is absorbed, worsen cardiovascular symptoms, or in some cases mask signs that your thyroid condition isn't being well controlled. Levothyroxine is particularly sensitive when it comes to absorption. Many people are advised to take it on an empty stomach and to separate it from certain other medicines, including antacids, calcium supplements, and iron preparations. If you're unsure about timing, your GP or pharmacist can give you guidance tailored to your situation. Now, when it comes to allergy medicines specifically, the type you choose really does matter. Second-generation antihistamines, things like cetirizine and loratadine, are generally considered the safest option for people on thyroid medicines. They're widely available, well tolerated, and less likely to cause the kinds of interactions that can be problematic for people with thyroid conditions. Oral decongestants are a different story. Products containing pseudoephedrine or phenylephrine, found in many combination cold and allergy remedies, should be avoided or used with great caution if you have hypothyroidism or any cardiovascular concerns. These ingredients stimulate the nervous system in a way that can worsen heart-related symptoms, and they're considered contraindicated in uncontrolled hypothyroidism. It's also worth knowing that in 2024, the MHRA, the UK's medicines regulator, issued a safety update linking oral pseudoephedrine to two serious but rare conditions affecting the brain's blood vessels. This is another reason to be cautious with decongestant-containing products and to always check with a pharmacist or GP before using them. What about nasal decongestant sprays? These tend to have lower systemic absorption than oral forms, but they still warrant caution if you have hypothyroidism, and they should only be used short-term, typically no more than a week. So what's the recommended approach for managing allergies when you have a thyroid condition? According to NICE guidance, intranasal corticosteroid sprays used directly in the nose are actually the first-line recommended treatment for allergic rhinitis, and they're considered safe for people with thyroid conditions. If you haven't tried one, it's worth discussing with your GP or pharmacist whether it might be suitable for you. If you do start a medicine that could interact with your thyroid treatment, NICE guidance recommends checking your TSH levels around 6 to 8 weeks afterwards to make sure your thyroid treatment is still working as it should. Here's what to bring up with your GP or pharmacist. Ask which antihistamine is most appropriate for your situation. Check whether any allergy products you're considering contain decongestants and whether those are safe for you. And if you take levothyroxine, ask about the best timing for your dose in relation to other medicines. If you notice any new or worsening symptoms after starting an allergy medicine, things like heart palpitations, increased anxiety, or changes in energy levels, do contact your GP. These could be signs that your thyroid medicine is being affected. And if you ever experience severe symptoms, particularly anything affecting your heart or neurological function, seek medical attention promptly. You can also report suspected side effects from any medicine via the MHRA Yellow Card scheme at yellowcard.hra.gov.uk. To recap, second-generation antihistamines like cetirizine and loratadine are generally the safer choice. Oral decongestants should be used with great caution or avoided, particularly if you have hypothyroidism. And nasal corticosteroid sprays are the NICE recommended first-line option for allergic rhinitis and are considered safe for people with thyroid conditions. This video is for general information only. Please speak to your GP or pharmacist before making any changes to your medicines. They can give you advice tailored to your individual health needs. If you found this helpful, leave a comment below. We'd love to hear your questions. And if you want more straightforward health information like this, give us a like and subscribe to the Bolt Pharmacy channel. We'll see you in the next one.